Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mom?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
I really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it. Stop CPR. He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
On this episode of Paramedics, he's obviously in a lot of pain.
This works really well, all right? I promise you it does.
But Stephen Jade's motorbike accident victim is refusing pain relief.
Take a big breath in. Again. It's working pretty good, isn't it? Yeah, I can tell it is because you stopped breathing.
An elderly woman found on the floor by her neighbours
Where is your pain?
is so distressed she can't tell Taney and Marley what happened.
I think maybe stroke-like symptoms. A fall for a 76-year-old is never just a fall.
And Jodie assesses a 55-year-old with an eye-watering medical history.
5 heart attacks, 6 stents and a triple bypass.
Trying to break records or something.
So, Steve, I feel like that's how I open everything up.
So Steve!
So, Steve, how are you today?
Steve! Quite formal.
Some days, it just feels good to be alive. And that's the vibe Jade has got as she hits the road with friend and paramedic partner, Steve.
Finally, it's a good day and the weather's nice and it almost kind of like matches your hair.
Matches my hair?
Yeah, did you like spend some time in front of the mirror before we came to work?
That's so not me.
As a paramedic, you spend a lot of time with someone in a confined space. You become intimately related with your working partner.
I wet my hair.
Yeah?
In the shower.
Well, I'm
tied it
glad
up.
you showered.
I did shower.
Jade is the one person I'm definitely happy to be around. It's always a good time when you're spending it with her.
You look like you could save someone today.
Emergency services.
The next job coming through may give Steve the chance to do just that.
Okay, tell me exactly what's happened.
A motorbike's been hit by a car.
Okay.
He's in a lot of pain.
Okay, yep.
The ambulance is on its way, mate. The ambulance is on its way.
The ambulance is on the way, so please do not move him unless he is in danger.
RC 139 received.
What are we going to, boss?
We are going to a male of 30 years of age and he's bleeding from the mouth. When I hear the job coming through that it's a car versus motorbike, my immediate thought is that somebody's going to be very injured and it's most likely going to be the person on the motorbike. The bleeding to the face, why would, unless, I hope he's got a closed face.
Could be riding a cruiser and he's got an open face helmet.
Do you wear open face or closed face?
Open face.
Do you?
Yeah.
Steve rides a bike and I've got really good family and friends who ride bikes and I just worry there's no safety element. It doesn't matter how expensive your gear is and how safe you are. You never know your place on the road because you've always got to be worried about what someone else is going to do.
Has he come off? Has he been ejected? We'll check his hips out.
How far did he slide?
Yep. His legs.
Injuries that a motorbike rider can sustain start from the head, move down to the neck, chest. We can go into loss of limbs, fractures, breaks, and these can all be associated with someone dying.
Just relax.
Emergency services.
Some of the most distressing calls to emergency services are from family members of a loved one in crisis.
Okay, tell me exactly what happened.
My mum looked to have what was like a seizure. She's vomited and she just did not look right.
Yeah, so she awake?
Yep. She's going in and out.
Mum, got some help organised for her, okay?
Yeah. 30 receive those details.
Intensive care paramedics Michaela and Simon are dispatched to the case code 1, but negotiating traffic at this hour will be difficult.
No.
This guy's going to have a car accident.
Yeah, I don't want to like pressure anybody to do anything silly.
Sometimes we'll turn off our sirens. This will stop other motorists from acting unpredictably.
Pretty close to the hospital, eh?
Simon's Italians are picking up.
I think I'm out, actually.
Don't you even know how to say hello?
Ciao.
Thanks, everyone.
As the pair get closer, a paramedic crew, now with the patient, send through an alarming update.
For a 64-year-old, a blood pressure of 90 is very low. It means that there's sluggish blood flow to the organs, and if it's not treated promptly, they can shut down and fail.
Just relax.
Steve and Jade are trying to assess a motorbike rider lying in the middle of the road after having a collision with a car.
He's been hit at 60k.
Yeah, probably done a pelvis.
We're going to get the pain under control, but I need you to take deep breaths. In and out. In and out.
It's really hectic. There's a car in the middle of the road that's basically got a bike kind of stuck under the side with the bike rider right next to it. And he clearly looks to be in bad shape.
Deep breaths. In and out. This is going to help with the pain.
Sorry, mate, we're going to cut your jeans off so we can have a look. No, it's the other leg.
Chief, this works really well, all right?
No, it doesn't.
I promise you it does. Just, all right? All right. Well, if you listen to me, let me talk you through this, okay?
Please stop.
Give it a try.
This guy is screaming, he's moving around, looked at his leg and thought that that looked injured. This guy's non-compliant. He's refused pain relief. I've just got to go in, take control, because otherwise he's going to be making things worse.
Take a big breath in, all right? Breathe out. Listen, take a big breath in. Again. Keep going. Let us do our work. We'll get you a needle, all right? I just want you to take in some breaths. Keep going.
Steve has an extraordinary way with patients, and he can be whatever they need. He can be warm and funny and kind, but sometimes he can be really firm and tough too.
It's working pretty good, isn't it? Yeah, I can tell it is because you stopped breathing.
I'm going to give you some strong pain relief, all right?
My leg's broken.
This patient definitely has a broken femur, and the force to break that femur would have been so significant. My other concern is now what's happening to his pelvis and then what's happening to his internal organs, as well as his head and his spine.
We're going to be okay, all right? You're with us. Al's here as well. He's the big boss, all right? We're going to look after you. You're all right.
Micah paramedic Al has arrived to supervise stronger pain relief before the patient's pelvis is cleared and a traction splint is put on his leg.
We've given the patient a significant amount of pain relief. He's had the green whistle or the penthrane, some ketamine and some fentanyl. But this patient is so agitated, it concerns me that he could have a traumatic brain injury.
You're safe. You're doing a good job, mate.
Now the splint's on, it will help reduce his pain and secure his leg in the right position.
All right. Onto your back, mate.
All right, there we go.
You're doing really well. Everyone ready? 1, 2, 3.
This patient has a capacity to go from awake and talking to being unconscious in a matter of minutes.
Yeah, come
We'll load him up. You can hop in the back.
Thanks.
Oh, yep, there we are. You pressed her up?
I did.
Yeah.
Simon and Michaela have just pulled up to treat a woman found by her daughter unconscious and having a seizure in the living room.
Hello. How you going? Simon. Hello, Nadia.
Today she's had pain all over,
Yep.
particularly a headache as well,
Yep.
and a cardiac arrest in September. She's got blocked arteries in both her legs.
Yep.
Had history of a stroke as well.
So the main problem is the headache?
Headache is very bad back pain
Yeah.
and stomach pain.
Yeah, okay.
I feel very sick.
We'll give you some pain relief, make you comfortable. We'll give you something for nausea.
No, it's up here.
All right, little scratch in the hand, sorry. So when you woke up today, were you feeling well?
I never wake up. No.
Wow.
I'm sick.
Wow.
I left the kitchen to come here because I knew I was going to faint.
It's been a frightening morning for Nadia's daughter, Melissa, who's watched her mum's health continue to deteriorate.
She walked from here to
Yeah,
here,
yeah.
and I'm going to pass out.
Okay.
And then just seized.
Okay. So how long do you think she was unresponsive for?
30 seconds.
Okay.
And I threw her on the floor on her side.
Yeah.
And then got some perfume to wake her
Yeah.
up.
Yep.
She sort of came to and then started vomiting.
Yeah, right.
I feel really sorry for Nadia's daughter and her family. They've seen her go through a lot over the last couple of months. And again, now today, she's had another medical event, which would be really scary for them all.
Do you mean dry for an adrenaline infusion?
Yeah, sure. She's got a headache. She's got a chest, abdominal, a querying, maybe a dissection or something along those lines.
We're thinking today that Nadia might have a tear in her aorta, meaning that there would be a significant amount of blood bleeding internally. The worst case scenario is that this tear can continue to get bigger and bigger, and it happens far too quickly for what we can actually manage, and then she might die here at home.
We've got to be able to get her up without her fainting. She's had an unconscious collapse. If Nadia is having an aortic dissection, I need to give her some pain relief and reduce the strain on the body and get her to the hospital fast.
Is the bed ready to go? Yeah, it's lowered down.
Are you in any pain at the minute, Mo? Are you sore? Where are you sore, mate?
In Melbourne's southeast, Steve and Jade are trying to calm their motorbike accident patient so they can get him to hospital.
You're safe, mate.
Micah paramedic Al is on board in case he goes downhill en route to hospital.
We're just gonna put this collar on and then we can go.
Yep, no worries, mate. All good.
Don't move. Don't move. Right.
All right.
I'm outie.
Bye. It's good, thanks. I'm gonna be here with you.
Other than giving this patient pain relief, we just need to get him to a major trauma centre fast.
Ready when you are, mate.
Okay.
All I want you to do is to just really relax for me, okay? Can you relax for me? Is anything sore where I'm pushing? No? Arm down. Can you relax this arm? Relax this arm. That's it. Relax, 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 relax.
Just try and have a chat to him, Steve. You're good at talking to him.
Ketamine's a great painkiller, but it can also cause dissociation at the very extreme. The main thing here is just to reassure him and tell him he's safe.
Are you sore anywhere?
Yeah. I'll tell you what's wrong with you.
Yeah, you tell me.
Foot.
Yeah.
Broken.
Yeah, your foot's sore?
Right. My fibula.
Yeah. Have you broken your fibula?
Yeah, it's broken.
Yeah.
It's the upper bone.
The upper bone? You've broken your femur? All right.
This bloke's barely strung a sentence together for the last 30 minutes, and then next minute he's put an injury list together, which is exactly what I've found, and then he's back to being emotional.
We got to take you to the Alfred because you've had a big accident, okay?
He'll get a scan of his abdomen, he'll get a scan of his chest, and pretty much his whole body, and then blood tests and ongoing management for his pain.
We're here now, okay? We're going to pull you out of the ambulance. I just need you to sit still. How you doing?
Motorbikes are dangerous. My wife worries every time I jump on the bike, and I give her a big cuddle and a kiss every time I go.
You're doing really well.
Are you able to poke your tongue out? You're very dry.
Simon and Michaela are concerned 64-year-old Nadia may have a life-threatening tear in the artery that leads from her heart. They urgently need to confirm or dismiss their suspicions before moving her.
So there's nothing grossly standing out on the ECG?
No.
So that's good. Have you been eating and drinking?
Yeah.
Yep. Tell me about this abdominal pain. When did that start?
I've been suffering my stomach for about 5 years.
Okay. And this headache?
Oh, there's something beating very hard like a heart in my head. Boom, boom, boom.
Was it a sudden onset or was it a gradual onset?
No, I have it all the time.
Nadia's blood pressure is still on the low side, but after hearing that the headache and back pain are chronic problems, this is reassuring that it's less likely to be an aortic dissection or a tear in one of the layers of the aorta, which is a good thing.
Before moving Nadia to the ambulance, Simon wants to lift her blood pressure with a small amount of saline.
So we're almost at 250.
Mum, love you, Mum. She's my mum and I love her more than anyone. And she's had a rough trot with her health. I just wish I could make it better. Yeah, it's horrible. I wish I could fix it, but I can't. You right?
Mommy. Hey, mate.
She's just a beautiful person with a good heart and loved by many, loved by all, especially her grandchildren.
All right. We're going to take a seat on this chair. Ready, set, go.
Very good.
If we move Nadia too quickly, the fear is that we exacerbate her low blood pressure, she loses consciousness and possibly has another seizure. You feeling all right with that little bit of movement, Nadia?
Yeah, I'm all right.
When a patient like Nadia presents to us with such a long list of complex medical problems, we do think the worst. She could have some complications post her triple bypass surgery and her cardiac arrest last year. She could have some type of infection, or there could be something going on inside her brain and she might have had a neurological event.
So 92 on 70. As far as it's a little bit on the low side for you, but I would like them just to do some more tests before we bring your blood pressure up too high.
Are you happy for me to move?
Yeah, I'm right to go. Yeah, thank you.
Patients are dynamic. Things can change in seconds, so we need to be on top of it at all times and pay close attention to the way the patient presents and if anything changes on the way to hospital.
I never want to have an attack again.
Did you have chest pain with the last heart attack?
No.
No.
I took myself to casualty.
Yeah.
I stopped feeling well.
You drove yourself to hospital? Wow.
The next day I ended up having cardiac arrest.
Well, I'm glad you didn't do that in the car.
I know.
Yeah.
You get up in the morning, you never know what's going to happen.
Well, this is true. When Nadia gets to hospital, they'll do some blood tests and a CAT scan and observe her to hopefully determine what might have caused Nadia's seizures. All right, we are here. There we go.
I hope that Nadia gets home soon and she gets to spend some time with her daughter and her grandchildren.
Good work.
On the other side of Melbourne, Micah's single responder Jodie is on her way to a 55-year-old man with severe chest pains.
Obviously, my primary concerns are what's causing his chest pain and is it related to his heart. There is obviously the potential of a 55-year-old male to be having a heart attack. And worst case scenario, if that heart attack is left untreated, they can go into cardiac arrest.
A heart attack is caused by a blockage in one of the coronary arteries supplying the heart muscle with blood. When there's a blockage, the area of muscle that is supplied by that artery essentially doesn't get any oxygen supply at all. And when that occurs, the heart muscle does start to die. Hi, how are you going?
Waiting at the door is the patient's worried wife, Debbie.
Hi, how are you going? Not too good, I hear. No, my name's Jodie. What's your name?
Greg.
Greg, nice to meet you. What's going on tonight, Greg?
I've had ongoing chest pain today, just at 7:30, 7:15 or something. Just come on really bad, central and left. Trouble breathing. Had 2 of these.
Yeah. And did that help at all? No. Okay.
Greg has a long, complex history of heart issues.
This evening, Greg has enacted his management plan for when he experiences chest pain, and he has taken his anginine spray to decrease the workload on the heart and hopefully reduce his pain, but that hasn't worked tonight, which is why he's called the ambulance. So have you been to the hospital for this chest pain before, Greg?
Only a couple of weeks ago.
Yeah.
Back in.
Okay.
All I know is I've got one artery that's still blocked.
Okay.
I had a triple bypass done and it was too small to bypass.
Okay. So you've got a bit of a complex cardiac history from the sounds of it.
5 heart attacks.
5 heart attacks, my God.
6 stents and a triple bypass.
5 heart attacks, 6 stents and a triple bypass at the age of 55.
Yeah.
You're trying to break records or something. In my 13 years as a paramedic, I don't think I've come across anyone that's got a more extensive list of problems, so he's really been through the mill. His heart is obviously already damaged, and the risk of someone then having another heart attack is obviously a lot higher. I'm just going to take an ECG of your heart. So it's not uncommon for you to get chest pain, is it?
I've got a blood clotting disorder.
Okay, what's that one called?
Protein C deficiency.
Okay.
So sometimes I have PEs, but it feels a bit different. It's just come on and it just got worse and worse.
A PE, or pulmonary embolism, is when one or more arteries in the lungs become blocked by a blood clot.
Greg telling me that he's got a blood clotting disorder as well does increase my level of concern once again. And that is because if he's got a higher risk of essentially forming a blood clot within his body, he is at higher risk of having heart attacks. Can I just get you to stay as still as possible for me for a moment there, Greg? I need to get the results from the ECG so that I can act quickly if he is having another heart attack. It's nice and still, even breathing for me.
As night falls over Melbourne.
Emergency services. Okay, tell me exactly what's happened.
Lady that lives here has fallen over on a wet kitchen floor and she can't get up.
Okay, is she still on the floor?
She's on the floor, we don't want to move her.
I'm organising help for you now.
Falls are the largest contributor to hospitalised injuries and a leading cause of injury death. So Marley and Taney, Ascent Code 1.
We've been dispatched to a 76-year-old female. She's on the floor. Poor darling.
When we're going to a fall, our first thought is, how did they fall? Was it a mechanical fall, meaning they tripped on something, or was it a medical event, such as a stroke or a cardiac event?
It says, unable to obtain detailed information. Patient is in severe pain and too distressed to speak.
Right. Show me it's the one with the lights on.
Hello, darling.
I didn't want to move her. A fall for a 76-year-old is never just a fall.
Just try and slow down your breathing for me, okay?
This could be a life-altering or even a life-ending episode for this elderly lady.
What's hurting? What's hurting?
What's hurting?
Tegan has been on the road with Brett for a few weeks now, and not once has she accidentally called him Dad in front of a patient.
A lot of people have said, oh, is that weird working with your dad? But straight away, I felt really comfortable. Being quite new, I still have quite a regimented clinical approach where Dad's quite easygoing and gets in and gets chatting and eventually gets to the bottom of the problem.
Their first case tonight could test both of them.
RC 139. Chest pain. Code 1. 17-year-old male. Oh, my God.
A Code 1 call for chest pain is not unusual, but the age of Brett and Tegan's patient is.
This is an odd age. 17's quite young to be having chest pain, so I would be surprised if this is actually related to the heart. Could be something serious, not worth mucking around with.
Chest pain can mean a lot of things, but this kid could have an infection putting pressure on his organs. It could be inflammation of the heart or myocarditis, or at the most serious end of things, it could be a life-threatening heart attack.
Looks like people are moving, they're stopping, good to go.
Chest pain
needs to be acted on. You can't wait till tomorrow. There might not be tomorrow.
When you had your heart attacks, Greg, did they show up on the ECG with the ambulance?
2 of them did, 3 of them didn't.
2 of them did, 3 of them didn't. Okay, yeah.
In the outer suburbs of Melbourne, Jodie now has the ECG results that will confirm if 55-year-old Greg is having his 6th heart attack.
What I'm looking at here looks pretty good at the moment, Greg.
Yep.
Yep. So your heart rhythm is normal. You're having the occasional ectopic, like you said, is normal for you. But I can't see any signs that I'm overly concerned with at the moment. So if the pain was a 9 when it started there, Greg, what number out of 10 is it at the moment?
It's only dropped to about 8, hasn't it?
An 8. Okay. I'm just going to have a listen to your breathing, if that's all right. Greg's not having a massive heart attack at the moment. However, I'm concerned as to whether there is something else going on, whether he's got fluid on the lungs. He may well be having a PE or a pulmonary embolus. They're all concerns that are running through my mind. So what I'm going to do is I'll organise to pop a little needle in your arm. Once I've done that, I am going to give you some more Angine. So more of the spray.
Mine's done really good because I had a heap of chemo once and I never recovered.
Your veins? Yeah. What'd you have the chemo for?
I had stomach cancer.
Oh, did you? Yeah. There we go. More history. So how long ago was the stomach cancer?
That was when I was 20.
When you were 20? Jeez. Yeah. Got a myriad of medical problems, don't you? Just a sharp sting in the back of your hand. OK, nice and still for me. Greg's blood pressure is a little bit elevated at the moment, which can be causing some extra pressure on his heart. So I'm going to give him some medication, some GTN, to help bring down that blood pressure and hopefully relieve the pressure on his heart. Hi, how you going? I'm Jodie.
How you going, Joel?
Mel, Joel. This is Greg. Greg is our patient this evening.
How you going, Greg?
A second paramedic crew has arrived to help transport Greg to hospital.
You know the drill, don't you? Probably better than we do. I wouldn't be surprised. Yeah. So how long's the trip down to Frankston from here, Greg?
7 minutes.
7 minutes, you think? Yeah. Wonderful. Few bumps. Just because Greg isn't having a heart attack right now doesn't mean that he won't deteriorate to the point where he's having a heart attack. So I really need to keep a close eye on Greg and make sure that his condition remains stable. How do you go with your wife at home? Is she worried sick about you, considering how bad your history is?
Yeah, she's worrying more and more now with, especially the last few days losing both celebrities and all that with heart problems.
Yeah, which is an absolute fair call.
I've survived 5 heart attacks, so my luck's got to run out sooner or later.
Let's hope not for a while, hey? You're only 55. I have quite an extensive cardiac history, which is a little bit unusual for someone my age. I have something called dilated cardiomyopathy, and I have a lot of arrhythmias associated with that, which has essentially rendered me needing to have a pacemaker at the age of 30. And that, I think, really allows me to be quite empathetic towards patients that are experiencing the same thing. I can understand what they're going through and what they're about to go through in terms of their treatment and ongoing management of their problems. There you go. Just a couple bumps on the way down there, Greg. Now that we're at the hospital, Greg will have a blood test to determine if he is having a heart attack tonight. However, he will also undergo a lot of other tests to try and work out what the cause of his chest pain is, if it isn't his heart. It's a good drive by Mel, yeah?
Good drive.
I don't think it was 7 minutes, though. I reckon it might have been closer to 10, hey? Greg's already survived 5 heart attacks, so I really do hope that his luck doesn't run out tonight.
Lorraine, where is your pain?
Taney and Marley's patient Lorraine has had a terrible fall in her kitchen. The 76-year-old can't be moved until they get a full picture of what's going on.
Sweetheart, I'm so sorry. I can't understand you at the moment.
Assessing Lorraine is extraordinarily difficult. We don't know if she's had a medical event and cannot communicate with us, or she's in so much pain that she's unable to talk to us because of that.
Lorraine, what happened?
Lorraine's neighbours were making dinner when they got an unexpected SOS from their elderly friend and rushed over to help.
Where the neighbours crossed the road. So I got a phone call.
Yep.
Say that she's fallen on the floor and she picked it up.
Lorraine is a kind, lovely neighbour who is more than willing to help whenever you need anything.
I can't get her to answer questions. It's okay, you're okay.
While we were waiting for the paramedics to arrive, I literally sat on the floor with Lorraine and I was holding her hand just to make sure that she knew that there was somebody there with her.
She made us chocolate chip cookies.
Aw, sweetheart. Lorraine, I'm going to give you some pain relief up your nose, okay?
You're gonna have to give me the ears while she's there, just in case she's hit her chest. Her chest is clear. I think maybe stroke-like symptoms. Lorraine's vital signs are abnormal. She has a low blood pressure, a high heart rate, she's altered conscious, potentially having a stroke. We're worried about her airway and we're wondering, does she have internal fractures or does she have internal bleeding? We need to get Micah here. RC139.
RC139.
Can we please have the closest Micah unit, please, coming on A1?
Speed up.
Brett and Tegan are pulling up outside the home of a 17-year-old complaining of chest pain.
Hello. Are you Mum? Okay.
You don't get many cases of young people with heart issues, but we can't just discount it straight off the bat. We have to go and investigate because it has happened, it does happen, and this could be just that one where it's happening.
Who have we got here?
Fidel.
Fidel. Oh, what's going on?
Well, in the last few hours, it's become very, very hard to breathe.
Do you have any pain when breathing?
It feels quite tight around the chest.
And with the tightness, 0 is no pain and 10 is worst pain you could ever imagine. Where would you sort of place it?
Probably a 4.
Okay.
Fidel looks hot, sweaty and lethargic, and I can see that he's really struggling to breathe.
Does that make... Yeah.
He doesn't seem like the kid to overstate his symptoms, so this is really worrying.
Just going to grab your temperature, Fidel, OK?
The fever just feels like it's got worse.
Yeah, are you feeling hot and cold or in terms of...
Incredibly warm underneath.
Yeah, well, your temperature just came back as 39.9, which is very high. Yeah.
Have you drank much water today?
Not too much, no.
Can I just get you to poke your tongue out, champ? You're correct, you haven't, have you? Need to keep some fluids up, buddy. Going to put Fidel a couple of dots on, champ, so I'll put it on the tummy.
Have you ever had a pain or tightness like this before?
Not that I can.
There we go. So breathing normally, Fidel, OK? You're just taking a picture of your heart. Try not to cough, buddy.
So everything is going up and down as it should, and your heart is ticking along a little bit quick. So you've got an infection going on somewhere.
We've done an ECG and that's come back NAD, which is no abnormalities detected. We find that Fidel's heart rate is still above a normal rate for a young fellow. It is concerning and we need to find out what's going on.
After a dose of paracetamol to reduce Fidel's chest pain, it's decided there are enough red flags that a trip to the ED is warranted.
Any changes standing up?
I just feel dizzy.
Bit dizzy? Yep.
Head's throbbing.
96/50 standing now, so...
Yeah. Fidel's blood pressure's dropped, his heart rate's gone up again.
You're definitely struggling, aren't you? Yeah.
If left untreated, it could be dire for Fidel. He could become unconscious and go south from there. We need to get Fidel to hospital as soon as possible.
Have you got pain in your chest? Pain? Pain?
While Taney and Marley wait for Micah backup, they continue assessing 76-year-old Lorraine for any fractures and whether she is suffering a stroke.
Lorraine, can you squeeze my hand here? Can you squeeze? Yes? Wiggle your fingers for me.
Help has arrived to ease Lorraine onto her back and get a neck collar on.
Mix up there with you as well as Marley, okay? All right, darling, sorry.
Lorraine, we need to get you onto your back. There's no easy way to do this. I'm so sorry. It's not going to be comfortable, but we've got some pain relief on board. Is everyone ready?
Yep.
Ready, set, go.
It's all right, don't fight, don't fight, don't fight.
It's okay.
All right.
I've got you. I've got you.
All right.
I've got you. It's okay. Relax.
Okay.
Relax.
Do you mind readjusting the pillow? I'll just lift it. Yeah.
Well done, Lorraine.
Hey, Sam, how are you?
Hey.
At this point, Lorraine's vital signs are so abnormal that we're worried that she is having a medical episode. So having Mike and Sam arrive takes that extra pressure away from us, especially when her airway is potentially compromised with her decreased conscious state. On, go, ready, set, go.
Lorraine is carefully moved out to the stretcher on an evac mat. It's one of the trickiest parts of the job.
Okay, couple of bumps.
That's it.
It's all right, we've got you. You're all right, darling.
The potential for Lorraine to have broken bones is high. Hold on. But our concern here is that if she is in fact having a stroke, that she could stop breathing and go into cardiac arrest and die. I know, Dale, you're doing good.
You're doing so well.
Yeah.
Having trouble talking, is that right? I realise you can talk to us. We're just having trouble understanding.
95%, 94 on route there.
Okay.
Elderly patient Lorraine had spent her day baking before a horrible fall.
You're doing really well, Lorraine.
Taney, Marley and intensive care paramedic Sam are now worried she's got a serious bleed on her brain.
Can you squeeze my fingers for me? Good. And on this side? Good. Can you lift your arms in the air for me? Lift them up. Keep them there for 10 seconds. Keep them there, keep them there, keep them there, keep them there, keep them there. Very good. All right. We're going to take you to Monash Hospital is the plan, okay? Make sure everything's all right.
Lorraine's now able to open her eyes and obey commands to an extent, but she's still far from out of the woods.
Okay, ready to go?
Okay. Sam, the Micah paramedic, is in the back with Lorraine, so if she deteriorates, he can intervene.
Just turning the lights down there so you're not bright in your eyes.
The fact that Lorraine's conscious state is improving, we're thinking that potentially she's having a transient ischemic attack, which is where blood flow in the brain is temporarily blocked, and it mimics things like a stroke.
Just shine a little light in your eyes there. Open your eyes again.
It's okay, Lorraine.
Now borrow this hand here. I'm just going to give you some medication. Just give me a hand. Hey, Lorraine, we're nearly at the hospital now.
Lorraine's a gem in her community. She bakes cookies and delivers them to her neighbours. These falls can be life-changing. I've been to patients before that have had falls and they end up in nursing homes. So for her to be able to come home, that would be the ultimate.
Try and relax as much as you can, Lorraine. You'll be very well looked after here. We'll get you inside at Monash, Lorraine.
How important is it having good neighbours?
Oh, so incredibly important. My neighbours are the best. I'm so lucky.
Everyone in my street's a good egg.
Yeah,
Pretty
I mean,
lucky too.
Why wouldn't you be good to Lorraine? She bakes you cookies and brings them across the road and, you know, a very distressing sight for her neighbours. They couldn't make any sense of her.
And for them, they've done all the right things. Poor thing.
Poor Lorraine.
Poor Lorraine.
Not good at all.
No.
We're going to get the pain under control, but I need you to take deep breaths.
Steve and Jade could tell straight away their patient had severe injuries after he collided with a car while riding a motorbike.
All I want you to do is to just really relax for me, okay?
When they arrived at hospital, doctors quickly assessed the man and treated him for multiple fractures.
I feel very sick.
We'll give you some pain relief, make you comfortable.
Nadia had not been well after a triple bypass some months earlier. But when she collapsed on the couch, having a seizure, daughter Melissa feared the worst.
Mum, love you, Mum. I've seen my mum sick, but this time was very different. She went from 0 to 100 very quickly. I felt absolute despair at that moment. Here you go, Mum. Here's your coffee.
Thanks, Mel.
Love you.
Love you too, Mel.
So glad you're feeling okay.
Me too.
And even though that day was terrible for the whole family, Nadia luckily pulled through.
And I'm glad you're back home. Are you feeling okay now?
Glad to be home.
No, I was very scared that day. That was not fun.
Frustratingly, specialists are still trying to find the cause of Nadia's seizure, but she is grateful to be doing a bit better.
I really thought I wasn't going to come out of it, not knowing whether I'll ever see my family again or not. You're playing with chalk? What are you drawing?
Oh, wow.
So seeing their little faces made me forget about all the pain.
When you had your heart attacks, Greg, did they show up on the ECG with the ambulance?
2 of them did, 3 of them didn't.
55-year-old Greg feared he was having his 6th heart attack after suffering severe chest pain. At hospital, doctors confirmed Greg wasn't having a heart attack, but had excessive fluid on the lungs that was putting enormous pressure on his heart, causing the pain. Greg spent 5 nights in the coronary care unit on a combination of antibiotics and diuretics, resulting in a 3-kilogram weight loss. He's now home with wife Debbie, dealing with life as best he can.
But just normal breaths in and out of your mouth for me.
Fidel's mum called for an ambulance when her son started struggling to breathe and complaining of chest pain.
You're in very good hands.
At hospital, tests showed the 17-year-old had a severe case of the flu. And after a few days bed rest, the Year 12 student happily returned to school.
Lorraine, it's really important you slow down your breathing.
It's been 3 months since Lorraine made a desperate phone call to her neighbours after a terrible fall.
You're all right, darling.
Sarah and Ian rushed over to find Lorraine face down and feared the worst for their friend.
When she actually wasn't really responding to any questions that we were asking her, that was when the concern came, really. And I did get worried.
Hi, Lorraine. It's really great to see you. Great to see you too.
Incredibly, Lorraine survived the terrifying episode, but did need surgery for a broken hip and went on to suffer 3 mini-strokes, which she's still recovering from.
How long do we have to bake these for?
About 15, 16 minutes.
Okay, cool.
Can't remember the ambulance coming, can't remember the ride in the ambulance, can't remember anything for the next 3 or 4 days.
How do you feel now that it's all over?
I've got a lot of work to do with my physiotherapy and getting back on my actual feet again. It is nice to be home, and because I've got very good neighbours, they often come in and check up on me or phone me or text me.
And it's nice to know that you are back cooking, making your chocolate chip cookies again.
I'd deeply like to say thank you very much to the paramedics that came on that night and helped me, because I know they took good care of me. Thank you so much for being great neighbours. I really appreciate it.